Good morning, everyone. My name is Dr. Tamisha Denis of Modern Melon Implant Center, and today I'm sitting here with Mr. James Holmes.
Good morning.
He's our treatment plan coordinator in our Coral Springs office, and we work closely together, making all of your dental dreams come true. So today we're going to talk a lot about insurance, and I know a lot of people have a lot of questions about insurance because insurance is one of those tricky things that we have to navigate through in order to get the dental work that you want to get done. So the way it works in our office is when you come into our office, you have your x-rays taken, you sit down and talk to me, and we talk about what your dental needs are. And once that is done, you're going to meet Mr. James. So at that point, what I do is I'll go and sit with James for a moment, and we'll talk about the different challenges that you might face, and maybe if you have a wedding coming up, or if you're going on vacation, you have to navigate, or you're not sure how your dental insurance works. And I always tell my patients, I say you might need a PhD in dental insurance to understand how to navigate through the whole things, the claims process and all that stuff. But you don't need to know any of that stuff because we know how it works. So the first thing we're going to talk about is kind of what a treatment plan coordinator is, and that's what we call it in our office, and what a treatment planner coordinator does to help you get your dental work done. So James, we're talking about, how treatment plan coordinator works. How do you feel about your role as a treatment plan coordinator?
I feel about my role as a dental treatment plan coordinator, I actually love it. I actually love talking to the patient, reviewing any diagnostics that the doctor recommended, and relating to them as a human, not so much as a doctor, the clinical side of the business.
Awesome. I mean, I think that when we sit down and talk to a patient, or when I in particular sit down and talk to a patient and they understand everything, I've used illustrations to explain it. At the point in which a patient asks me, how much is that going to cost? Then I know my job is over, because I really do try to spend a lot of time explaining that. And at that point, really, I don't have a lot of answers. And the answers are really going to come for the treatment plan coordinator. So we're going to answer some of the more common questions that most people have about dental insurance. And maybe not every single circumstance may apply to you, but I think that will help you to learn a lot. Because I feel like even though some people have a certain dental plan at the beginning of maybe their employment, when they're not employment, it may change. So knowing these things are really, really important. Whether you come to our office or any office in particular, I think it's important to know. So the first question that I get a lot is, what is a PPO dental insurance plan?
Well, PPO, a dental insurance plan, is a preferred provider organization. And what that means is the patient can choose any dental office that they want to, and they do not have to be assigned.
Okay.
The PPO is actually, the insurance company allows a maximum per year.
Okay.
For example, it's usually between $1,000 to $2,500 for most patients. In those situations, those patients do have to pay normally a deductible once a year, usually anywhere between $25 to $150.
Now, I have a question. When someone has a PPO dental insurance, do they need to know all of those things about maximum and deductible before they come in?
They should be familiar with it, but that's where I come in, because I always ask the patients, are they familiar with their insurance? And if they say yes, then I get into a little bit more further and evaluate their insurance, let them know what benefits they have and what they don't have based on their fee service and their insurance schedule that we verified.
Very good. So it's really important when you call into the office, we do take your initial dental insurance information over the phone. Usually we're going to verify that when you're not here, so there's some background work that happens. And once you arrive, we already have your fee schedule ready to go.
Yes.
So once you speak to me, then you speak to James, and he's going to go through everything in detail. So it's very clear what is insurance going to pay and what your portion is going to be.
Correct.
Now we're going to talk about what is an HMO, because an HMO is a little different. There are variations of HMOs, correct?
Yes. There's a bunch of different HMOs, and I'm still learning myself. There's so many different plans of HMOs and insurance carriers.
PhD.
Exactly. With the HMOs, it's a health maintenance organization. Those patients do not have an annual maximum. They have no deductible, but they do have to be assigned to a network doctor. So normally the patient has to call their insurance company and be assigned for that particular office.
Now, can they request if they would like to come to our office? Can they say, I'd like to see Dr. Denis?
They can, as long as we're a network. If we're not a network, they may have to pay an additional fee. but normally they can choose any dental office. Yes.
Awesome. And we like to accept as many plans as we can, depending on your employer, is really what you're going to have access to.
Exactly.
Right.
Exactly.
Okay. So now we're going to talk about Medicare and Medicaid.
Yes.
What is that?
Yes. Well, those are two plans with everybody gets confused. Medicare is a plan that is through a federal and state program that normally serves individuals over the age of 65 years old.
Okay, that's Medicaid.
Medicare, yes.
Medicare, I'm sorry.
Medicaid is usually an assistance program for those for the lower income for all ages. Those are very selected plans. Very few offices take those plans, but there are options out there as well.
Awesome. So in our office currently we accept Medicare, correct?
Correct.
All right. So, and is Medicaid more for children?
It's for children, yes, but there's also adults as well for lower income, parts of the regions that do accept that as well.
Okay, and that does vary by state, correct?
Correct.
Okay.
Correct.
Now, I have another question. So, of course, when you have dental insurance, there are going to be co-payments involved.
Correct.
If they sit down and talk to you and they say, okay, James, my co-payment is going to be XYZ, and they can't afford to pay their co-payment, what do we do at that point?
That's where I love to come in because I love solving problems. Patients, they never know what the actual cost of a dental treatment plan is going to cost, so I like to make it flexible for every patient. We can dive into financing. We can split up the payments. We offer a special discounts if they're going to pay all in cash. For individuals who's on a monthly budget and really tight with income. We sit down and really evaluate what they can afford.
Right.
And really sit down and say what's most important. Maybe we can't do the full treatment, but maybe we can focus on the upper right side of the mouth or the lower left and start somewhere and make it affordable for that patient.
And I think that's where the partnership between the doctor and the treatment plan coordinator goes, because clinically what we're going to discuss is what is most important, especially when we're on a budget. Sometimes I have someone, they say, I'm ready to do it all. And then we're going to still figure out, okay, we're going to do this first and do this second and do this third. Yep. And I try to communicate that with James so that he knows, okay, so these are the priorities. Usually it's in pain, abscess, infection is usually the priority. And then once we do that, we can know if it's something that we can do together in clumps and that sort of thing, and that's going to go along with the budget. So when you leave, what will they take home?
They will take home a printed out document. It's a signed document that a treatment plan that I presented to them, and it has their fees, whether they have an HMO or PPO, any discounts that we provided for cash, special financing, so they know when they come in what the exact cost is for that procedure or for the whole procedure.
And of course, a lot of that stuff is in dental language, so we really try to help you understand, when you see ulcer crown, what does that mean, or, certain dental terms. So we try to explain to you all of those things so that you're very clear on what your insurance copays are, what insurance is going to do, and what your portion is also.
Yes.
Another thing that I get a lot, and I always direct that towards our treatment plan coordinator, is if someone doesn't have dental insurance, sometimes they'll say, Dr. Denis, I think it's open enrollment at my job or something like that. What insurance should I get, or should I even bother getting insurance?
Yes.
So what do you think about that?
Well, it depends. If a patient needs a lot of diagnostic treatment, I always would recommend a dental PPO. But if they don't have that much dental treatment, I would also recommend maybe getting an HMO or PPO, whatever works for them and their family. I just give my recommendation. You don't need dental insurance to take care of your mouth.
Right.
We're really flexible, whether you have an HMO, a PPO, or no insurance at all. We offer an in-house discount plan. But as far as the patient, my job is to make it flexible, to make it affordable, to help the standard of care for that patient.
Right, because like James said, sometimes I'll meet someone and all they need is a cleaning, and if all they need is a cleaning, then we can just say, you know what, pay whatever it is every 6 months for a cleaning. But if you need a lot of work, sometimes you need some help, and that's something we're going to delve in terms of financing in another video. But that's something that you definitely can do. All right, one of the last questions that a lot of people ask me, and I think that's more employer related, and you'll answer that for me, is what is a flex spending account?
Yes, a flex spending account, a lot of people like to use that to actually pay for any healthcare treatment. Pretty much what that is a special account. It's a tax deferment, a tax vehicle. Usually you get from your employer. Sometimes they match, sometimes they don't.
Okay.
And you can use that to pay for any healthcare costs that you acquire throughout that year.
Okay, so it's something they can draw upon.
Correct.
And they know what their limit is at that point?
Yes, they know how much they have availability because normally each paycheck goes into this special account. So throughout the end of the year, it may say $2,500 is the maximum that they allow.
Okay. There's one question I forgot to ask when we were talking about maximums and PPOs and stuff like that. How does the year work? Is everybody on a January through December, or are people on different years?
Yes, that's a good question. With the PPO, normally most people are actually on a calendar year.
Okay.
So usually the policy is effective January 1st through December 31st.
Okay. So that's why it's really important towards the end of the year, and we try to encourage our patients when they come in to say, hey, it's October. If you have work to do and you haven't used it, if it's $1,200 or $5,000, well, whatever your maximum is, you want to use it because it will not roll over, correct?
Exactly. It will not roll over. I wish it did, but unfortunately, it does not.
Yeah, and I can't say how many times I meet people who work for various corporations, from Publix to Walmart to UPS, and they've had dental insurance for years, and they don't touch it. And they're really just losing that benefit that their employer has provided to contribute to their insurance.
Exactly.
Now, one other thing that we do provide in our office is that some people, especially with dentistry, are very concerned about the cost of what things are going to be. And just because of those costs, I can't tell you how many times people just count themselves out because they think it's going to be expensive. They don't even bother coming. And the reality is, our first visit, we're just speaking. We're just talking about what you need. Once you know what you need, there's no shots or needles involved. We just have a chat. And once we've done that and we've established what you need, you can sit down and talk to James, and we can decide a plan for you. Now, if you're really, really nervous about what is insurance going to cover, what is my budget, and you don't think it's something you can do, we can pre-arrange a meeting with James or any of our treatment coordinators in other locations, and he can sit down and talk to you about how that stuff works and your particular plan, because there are hundreds of dental insurance plans out there that work for you. Thank you, James, for sitting down and talking with me this morning. Dennis. I'm pretty sure a lot of the things that we talked about are things that are burning on a lot of people's minds. So thank you for watching. Make sure you check out a lot of our other videos. We have clinical videos. We have videos about insurance, social issues, all kinds of things. So thank you for watching.